I mean, that's just one of the unfortunate things about this virus. It likes to replicate and find other hosts and then replicate in them and wreak havoc.
Can your dog give you parvo?
When you think of parvo, think of vaccinating.
So speaking of treatment, I bring my puppy in, drop it off at the curb, spewing diarrhea everywhere, lethargic. You get the test back, it's positive. He's got parvo. Almost said COVID, that'd be bad. So he's got parvo. What do you do to treat? How do you guys act in the hospital with it? Is he just sitting in the middle of the room with everybody else, or is he isolated? How does it work?
We usually like bring him. We do the Simba. We show him to every single other pet in the hospital. Yeah,
that's right.
I'm just
but
kidding.
First,
just kidding. Yeah. No one should write that down. That is absolutely the last thing we'll do. As cute as he may be, he is infectious, and that is, plain and simple. Like, he presents a threat to other dogs in the hospital, especially those that might be unvaccinated. And so we're definitely not parading him around. We're definitely not holding him for the most part. And if we do, he's going to be in a strict isolation ward or specific section of the hospital where that is where he is. And to go in and interact with him, you got to be gloved up, gowned up. And then as soon as you do what you need to do, check his parameters, check fluid lines, discuss fluid therapy, you immediately take all that off, that PPE, and then go see your other patients after thoroughly washing your hands and all that. But yeah, I mean, that's just one of the unfortunate things about this virus. You said, it likes to replicate and find other hosts and then replicate in them and wreak havoc. So definitely puppies that are in a litter situation, it's good to kind of get them away from the other ones, just because it's in all likelihood other pets that are around him or her are really susceptible. And so kind of going back to one of the previous points about prevention, I guess, for those pets who are not yet symptomatic, may take some time, a couple days for after a pet has, ingested the virus, and, it's not going to be immediate symptoms. So the importance of preventing it from happening in the first place, and bleach is your friend in these circumstances. So kind of bleach the bejesus out of the environment from which he or she came, and try to keep all other pets away from it, and exercising good hygiene anytime. Prior to that, if you have in New York City, we don't really have yards. Down south in New Orleans, I was used to having a backyard, but anytime my dog would go out, that's where she would do her business. But picking up after them, and here it's on the streets, and so everywhere you walk in New York City streets, there's usually feces somewhere, whether it's from the rodents or from the dogs. You just got to be cognizant of that. So that's definitely what we do. Isolation for sure, wearing gowns, wearing gloves, not allowing any cross-contamination, kind of keeping everything to a minimum, is kind of the ideal approach to this. And as far as what we do, I'm sorry, were you going to say, Mike?
No, go ahead.
Oh yeah, and as far as what we're doing, it's not like just we're keeping the parvo puppy quarantined, where you're kind of pumping fluids into him or her, and usually, I've never had an owner whose puppy I've diagnosed with parvo not agree to hospitalization, because we kind of there's a lot of, in preparing for this presentation, I wanted to kind of see, what's out there on the internet, and there is a lot of great resources that I advise and often give the URL to owners about parvo, or whatever particular disease Fido may be having or suspecting to have. But there's a lot of misinformation too. And, I was just trying to see what they had out there in terms of the homemade or the home therapies for Parvo, and nothing like, to my knowledge, and we definitely didn't learn it in vet school, because to my knowledge, nothing is going to really help that you can do at home. You need to replace those fluid losses. IV fluid therapy, most likely an antiemetic, something like Serenia, is really going to be kind of the mainstays of therapy. But I saw activated charcoal, which can be good for certain pathologies, but really Parvo, it's not gonna cut it. Really the goal here is gastroprotectants and fluids. Having them hooked up on IV fluids. So
there's always the owner though that says I can do it at home. I know back a million years ago, we worked with a lot of dog breeders and showers and things, and they would say, either they would say, we can treat it at home, we know what we're doing, we don't need you, okay, have fun with all your puppies. But we did have an outbreak over the Christmas boarding season, in terms of a client brought in, it may have been about half a dozen German Shepherd puppies. We all had Parvo, and we had to kind of makeshift an isolation area to keep them away from all the other boarding dogs that were there, and nobody else got it except the puppies. But we had to hang plastic and tape off areas and do the Clorox. You mentioned bleach is the best. The little foot bath, you put the towel with the bleach in there, and before you go in and we only had certain people that were allowed to go into the isolation areas. But that was not a fun Christmas boarding with diarrhea.
How many dogs did you have boarded during that? I mean, because I used to work at a band field in Massachusetts, and it was connected. It was like inside a PetSmart, and they had like the pet hotel is what they called it. And I just remember on New Year's, the winter holidays, it was insane, because sometimes they would come to me for dogs that had stress colitis and just were I don't believe it was Parvo. They were older, vaccinated dogs, but who just had stress, and that can lead to some diarrhea. So I would go back there and be runs and runs and runs. The whole place was probably like several hundred dogs. But I can't imagine 5 German Shepherd puppies coming on Christmas. That's what a story.
Yeah, they brought us a lot of stuff. But yeah, probably our clinic was 100-something probably dogs over the break. We were capacity. I mean, every holiday from Christmas to after New Year's was in addition to all the normal was just this horrible boarding. I was very happy to move on to a practice that didn't have boarding. That was boarding is like, let me just practice medicine and not have to scrape poop out of kennels and feed dogs 3 times a day. So
as was I happy to kind of leave that practice, because I'd have my set schedule, all my appointments or surgeries and whatnot. And then on top of that, I would, the manager, God bless her, Kenya, she was awesome. But every time she came in and I was like at my desk or whatever, I knew that meant at least 2 or 3 additional cases that I have to go. It was just, another thing on the plate. But,
hey, that's all part of it. So wanted to let everybody know we are answering questions. We've got a chat over here I'm watching. If you guys are watching, if you have any questions about Parvo, put them in the chat. We'll read them out and we'll go from there. So we'll just keep on going on. Can your dog give you Parvo as a human being?
So great question. Thankfully, to our knowledge, no. Now, humans can get parvovirus, but a different subtype. It's very species specific. And much like cats, we vaccinate them for FVRCP feline viral rhinotracheitis, panleukopenia, which is a parvovirus, but it's specific to cats. Much like it is very, very, very unlikely. I'm not going to say entirely impossible, because I think there's a case report or two of a cat who has gotten parvo from a dog. I think, for all intents and purposes, this is largely, at least the specific subtype of parvovirus, CPV2, which causes all the nasty aforementioned symptoms that we've discussed. That's going to be for dogs. Now, even though humans, we can't get it from our pets, we can serve as vectors. So like, whereas the toys and food or anything in their environment are the fomites, like the inorganic substances that the virus can kind of be on and then spread to other dogs. As a living organism, we're considered vectors that could come, if we were petting our dog who, unbeknownst to us, has parvovirus, and we go to our friend's house, and maybe not during COVID, but we socially distantly hang out with them in the park or something, we could unwillingly be spreading it to them.
You mentioned the toys. If your dog has parvo, do you recommend getting rid of all his toys? Do you recommend bleaching where you can? We don't want to reinfect him when he comes home or if you give your toy to a different dog.
Yeah, I would advise not to give it to another dog. I guess it depends on the type of toy, and if it's a very easily cleanable one, definitely like bleach it, let it kind of be, and don't let him come back to it for a while. It's unlikely that he's going to be reinfected by it, just because dogs that, for those who do recover from parvo, around 80% success rate, they likely will have a really long-lasting immunity. So, they should be fine, but I do think kind of the best precaution is avoidance. And if you know for a fact that they've been playing it for a while, I think, even though it's an investment to buy a new toy or whatnot, I really think the safest thing is probably getting rid of it and then, buying new toys. Yeah, I honestly, like, it can be very expensive to treat, but we have to be cognizant. There's cost of prevention, but I think prevention the costs of that far outweigh the cost of treatment and the detriment. The suffering that the puppy will go through, with all the symptoms and through treatment, which isn't always guaranteed to be successful. So definitely, like, I wouldn't play with fire, even if a dog, you thoroughly clean the area and disinfect and, bleach as many surfaces as you can. There's always that possibility it's still there and could potentially be, in the environment or on like a raggedy chew toy or something for months or years. So if another dog comes, a few years down the line, I think the best practice is just to get rid of it.
And if they get their dog vaccinated, is that a guarantee they're not going to get parvo? I know there's a series of parvo vaccines. Is that correct?
It's true. Yep. We use like the modified live vaccine in our clinic, and it's like a combination. So distemper, adenovirus, parvo, and para-influenza virus. Is it a guarantee that they're not going to get it? Unfortunately not. And as I mentioned earlier, if a puppy, I usually think of the 6 weeks to 6 months range. Doesn't mean that puppy can't be younger or older, or even a full adult dog. Although I think the likelihood goes down much further statistically. But even if they're kind of like partway through the vaccine schedule, maybe they've received a dose or two, there's that doesn't mean that they're immune and they're fully protected. Just like we get the flu vaccine every year, we could still get it, and puppies can still get parvo. Now it's possible, even if they finished all their puppy vaccines at 16 weeks old, they can still get parvo. It is unfortunately is possible, and I always stress that to owners, because we have the core vaccines that I always recommend to owners: rabies, distemper. Leptospirosis is not a considered core, but it ought to be, in my opinion. Just with the risk, and dogs like the tendency to lick up puddles, standing water, and there could be urine from rodents, and especially here in New York City, I'm walking with my wife through the park and we see a rodent every other night. So a rat running right by us that's probably like the size of a cat. I mean, they're huge. So they're around. And
you should work for the New York Tourism Board.
Yeah, I would not be a good
come see the rats.
City. Come see them. But I recommend it, as do I. Rabies, and distemper. But even if they've received their boosters and everything, that they're unfortunately still susceptible, and so it's possible that the clinical form of the disease might be attenuated. It might not be as severe. They might not be showing as many symptoms, or if once we get them started on therapy, they might not need, some dogs need like 2 weeks of intense hospitalization, on fluids, antibiotics, antiemetics, whereas dogs, if they're fully vaccinated and yet they still get parvo, perhaps their clinical response will be faster, and they're not going to be in the hospital as long, potentially. But unfortunately, nothing is perfect. Yeah.
Now, speaking of being in the hospital, and you don't have to answer this if you're not comfortable answering this, but what is a broad estimate of how much it's going to cost somebody to have their dog hospitalized for a couple of weeks with fluids and blood work and treatment and things like that? If you're not comfortable, I'll move on to something else, but we'll talk about the rats.
Yeah, for sure. It's a great question. I'm honestly comfortable to talk about it because I can tell you I actually don't know. I mean, one of the beauties of the position I'm in is, I love that I can diagnose. I can, use my knowledge, my clinical impression of my patients to kind of, find out the histories from the owner, decipher what's going on. Like I had a dog that came in today. His owner came from Puerto Rico. They were just there for the holidays, I guess, an extended trip. And she tells me every year that he comes back, he gets depressed. He doesn't eat as much, and maybe he's constipated, and maybe there's all sorts of things that when I have, I'm talking to her on the phone because that's our policy, and I'm hearing all this, but the patient in front of me looks 100% A-okay. No, nothing wrong on physical exam. He has a little bit of dental tartar on his teeth, but so do 85% of the canine patients that I see. And he's young and otherwise healthy, great body condition, no fever. He looks awesome for all intents and purposes. So I'm hearing all this stuff from the owner, and I know, is it true? At the end of the day, the most important thing is, I'm advocating for the patient in front of me. And so I have the luxury of letting his owner know, this is what I believe is the case. I never confront an owner, say this is wrong, or I don't think he's depressed, or a little bit yeah. But this is, we can try to figure out a definitive diagnosis, figure this out, and then go ahead with treatment. And so that's really my job. I know kind of generalized price points of different procedures and diagnostics, and it will definitely vary depending on the type of practice, whether it's, I'm in a small animal private practice. If for patients who are, something crazy is going on that I really don't know, and we've kind of done a lot of testing, and, or I'm not at the capacity to really absorb this patient in-house, and it really needs, some specialized surgery or something, I'll refer to, the ER or the specialty hospital. And so, prices there may be different. It's going to vary on region of the country. So there's a lot of different factors that go into play. But for me, like, I'm always going to recommend kind of the gold standard as what I think is best for my patient. And so I know for a puppy who we've diagnosed via the the PCR or the fecal antigen test, we know that the dog is Parvo. I know what the dog needs, and I'm not 100% certain. There's no guarantee that the dog will survive, and I always upfront tell the owner. But I know what we need to do to try to get the dog to the best level that we can, and that's going to require fluid therapy. Get an IV catheter in them, get those fluids going, likely antibiotics, and some antiemetic and prevention of vomiting. And so throughout the stay, if you're going toward 2 weeks, we can get into the thousands, I would imagine, for US dollars. If a dog shows really incredible improvement within several days, and the blood work has improved and clinical signs have improved and abdominal pain has kind of vanished, then it's possible the dog will be discharged within 4 or 5 days. I would say the early end of things, and I think you're still it would be worthwhile to let an owner know kind of the ballpark, and the very least, I would imagine in our clinic somewhere in the low thousands, if I had to imagine.
Get that pet insurance.
Yeah, pet insurance is huge. And I think even though I can't speak for specific companies, and I would say maybe less than 5% of my patients have owners who, opt for health insurance. I think it's much more of a thing in Scandinavia. At least that's what we learned in vet school. But here in the US, I think it's catching on, but slowly but surely, I hope. But yeah, I mean, if it's a couple days, I may feel comfortable discharging a puppy with it, but I will continue to recommend isolation, because even after a dog has improved clinically and, back to eating, back, not vomiting at all, and just kind of back to his or her old self, for the owner, he or she is likely still shedding the virus for maybe even more, a week or so, or longer. So it's until we can kind of know for a fact that he or she comes back negative, I would advise, definitely not to be around other dogs. But I think if a dog's improving vastly with the supportive care, I think, it's really clinician dependent. But I think, a lot of us might feel comfortable with discharging.
So when the puppy comes home, in addition to kind of isolating for a little while when you get home, what other home treatments would you recommend post coming home with Parvo? Or once they're out of the woods with the treatments, they come home. Is there something you recommend that they give the dogs when they get home, or certain?
Definitely just, tender love and kindness, obviously a lot of love, just, spending a lot of time with the dog. I think one of the best ways we can show our love to our pets is, feeding them adequate nutrition. And some of those things can consist of, a really good quality diet, low fat, highly digestible. Some owners like to do the boiled chicken and rice means, and that's totally fine for some period of time. After a while, most vets, definitely myself, will recommend getting on one of the diets that's AFCO approved, or the American Association of Feed Control Officers. They will there's a regulatory body that kind of oversees all these different brands: Purina, Royal Canin, Hills, Eukanuba, Iams, all that jazz. The pet food market it's huge. Every other day I'm finding out about a new brand, some high-end chic boutique diet that an owner says, oh, it's grain free, it's whatever. And then I have to kind of caution them, well, grain-free diets are actually correlated with heart disease in dogs, and there is scientific evidence that would suggest maybe we should rethink that, or we should rethink raw, which is one of my pet peeves. An owner will come to me with their dog and complain that he's been having diarrhea for the last 3 days, and we switched him to this really name brand new diet, and it's freeze dried raw, and I have to let them know that these are all kind of buzzwords that are big in the field, but unfortunately might not be the best for your pet. And so
we would have people bring Ziploc bags in with like turkey necks in them and like raw ground beef, and this is what you're feeding my dog, and we would say okay.
I get raw rabbit chews here. I get crazy things, and I laugh in my head, but I also, like, some owners don't know, and some owners might be seeing a lot of stuff on the internet from sites that have great marketing, but those companies might not, at least in their business growth, yet have the research and development to kind of back up scientifically the food that they're putting out. So I think for a short term, something that's really highly digestible, just your one protein, the chicken and rice, like that could be really good. But kind of eventually, a gradual transition to regular puppy food, and around 1 year, depending on how old they are, for their typical diet.
What about probiotics?
Yeah, so probiotics are huge. I think one of the things that we, I guess, haven't touched upon yet so much was the risk with this viral disease that we've been talking about for all this time, with the possibility of secondary bacterial infection. And so that's just one of the things, like, owners might be like, oh, well, why, I get the fluids, we need to correct these, fluid deficits and, all these electrolyte abnormalities that are going on. I get that, but, why is my dog getting all these antibiotics? And so, the importance to underscore here is that, even though we don't really use antivirals with this particular disease, there's so much risk for bacterial translocation in the gut to kind of take over the intestines and just worsen the disease. And that's probably in large part, why you get that just malodorous diarrhea. And so we, broad spectrum antibiotics are, like ampicillin are, huge when it comes to treatment of parvo. And, anytime, no drug is benign. So antibiotics, as wonderful as they are, and as a big of a proponent as I am of using them, they can also, lead to worsening of symptoms potentially. That being said, I think it's important to use them here. But probiotics are, something that can be daily given to a pet to kind of help with that gut microflora, reestablish, kind of the balance of good bacteria in the intestines, and it's something that I also, will often recommend, not just for parvovirus, but really for, a plethora of intestinal diseases.
Well, I want to let our audience know that if you go to rockwellpetspro.com and use the code PARVO, PARVO, you get $10 off any natural dog probiotics. So that works out pretty well for everybody who's wanting to get their dogs on the probiotic train.
There you go.
Well, any other things you want to talk about with Parvo? Any we're here to educate people. We're here to talk about what can I give my dog Gatorade at home for Parvo, or can I what can I do? There's just something that maybe people don't know, or something that people would come in and ask you. You would hear it a lot and say, okay, this is where the misinformation is, or a lot of people come in and ask you the wrong thing. Can I do X, Y, and Z? And you go, All right. Let me go into my spiel about,
Right.
is there anything like that you'd like to throw in?
Sure. Let's see. I see. So some of these questions here were late effects of parvo. Can parvo cause hairlessness?
Right.
Can a dog get parvo twice? A lot. These are great questions. I guess jumping to the first one about late effects of parvo. I didn't know because I'm not familiar with that. It's not something that I learned about in vet school or that I've really seen over the course of my clinical practice. I checked a study online, uh, long-term effects of canine parvo infection in dogs, published in 2018, because I just didn't know. And so that's one of the beauty of our profession is that there's so much that is still yet to be known, and so that's the beauty of research. And even though that's not necessarily my field of expertise, I can rely on looking at these studies and looking up stuff that I just don't know. So evidence-based medicine is huge. And really what I saw in this, they surveyed, I don't know how many dogs they looked at, 67 dogs. A lot of what the owners reported were some chronic intestinal issues. Was kind of like the major one. Skin diseases really didn't, or like pruritus or hairlessness was not something that was thought to be, super, or at least reported by owners whose dogs were previously diagnosed with parvo. Was not something that was really mentioned, but there is, at least in a certain subset of the population of these owners who were surveyed, does seem to be some sort of potential correlation with dogs that have, whether it's, an immune mediated inflammatory bowel disease or something like that, or food allergy, where like kind of they're responsive to a change in diet. That seems to be potentially something that could be a long-term effect. But generally speaking, what I tell owners is that if a dog will survive parvovirus, he or she is not likely to have any severe, long-lasting, like long-term effects. So that's a very good thing. If you survive it, you likely will come out of it with great immunity. And hairlessness is not something that that's not even on my radar as to something to be worried. There might be some hairlessness if we shave their, shave them to get like a little IV catheter.
I was thinking like a sanitary cut, but yeah.
What's that?
I was thinking like a sanitary cut.
Yeah.
How common is parvo? Like, how many cases would you guys see in a year on average?
Can you repeat that, Mike? I'm so sorry.
How many cases would you normally see in a year of parvo? How common is it?
I don't know if I can answer that. I can say in the clinic that I've been at in New York, I personally have not seen a case of parvo. I think we're really good at our vaccine protocol, and we kind of are really strict by that. We follow the guidelines, and owners, generally speaking, are really good at compliance. I'm sure it varies by different jurisdiction and different parts of the country, but I'm knock on wood and watch next week. Unfortunately, we'll get like a case load, right. But yeah, I mean, I would say like in vet school we saw a lot more cases, and down south, like when I was practicing in New Orleans, that's where I was first practicing when I graduated vet school. We saw a lot of parvo, we saw a lot of heartworm, and I think it's one of those things where prevention just isn't taken as seriously, or it's not, think there's all sorts of factors, and there's hella mosquitoes. Forgive me for usage of hella, but just so many mosquitoes down there, and that's the vector that's going to be transmitting heartworm to dogs. And so dogs that aren't on heartworm prevention, or dogs who, just out of the lack of knowledge, owners or whomever may not, bring their puppies in for vaccines. And so I think the caseload down there was just a lot higher. But I think I've been blessed, at least in the Northeast, to not see as much cases, knock on wood. So, yeah. But that's really, I'm sorry, what was that?
We got wicked mosquitoes down here.
Wicked mosquitoes. Yeah.
Well, once again, go to rockwellpetspro.com and use the code PARVO and get $10 off natural dog probiotics. So before we wrap this thing up, I want to thank you, Dr. Bax, for your time. Is there one last kind of overarching thing you want to leave people with when they think of Parvo? I don't want to say when they think of Parvo, they think of you, but when they think of Parvo, what's the one kind of lesson that you wanted to, the last impression you wanted to leave people?
When you think of Parvo, think of vaccinating, because this is a largely preventable disease. It's going to be out there. It's going to be out in the environment, but only you can prevent parvovirus. You have such an important role in your dog's life, and especially at that time of, their immune system is not fully up to snuff, and you're embracing that bond, bringing your new puppy or your, rescue dog home. However your dog came into your life, you can advocate for them, and by bringing them to, vets like me, and we can kind of help you determine what is the best thing to help your dog stay safe from Parvo. And prevention via immunization is spot on.
Excellent. Awesome. Well, thank you, Dr. Max. It's great to see you. And I think we're going to wrap this thing up here. We've been at it almost an hour. And hope you guys have a great week. Stay safe out there. And we'll talk to you later.
All right, Mike. Take care. Thank you so much.
Thanks.